The most common bacterial infections that we see are impetigo and folliculitis. Impetigo is a superficial infection of the skin, usually due to Staph or Strep bacteria, and it usually will present with red, oozing, crusted patches. It's highly infectious, can spread from person to person or on one person, and usually will respond very well to oral antibiotics as well as topical antibiotics. Folliculitis is a staph infection that occurs in the follicles that looks like pimples, but most commonly somewhere in the body. When they get large and deep, can develop into what's called a boil, or medically what's called a furuncle. So a small folliculitis, if left untreated, has the potential to become a deeper, larger infection. What's very important in both of these bacterial infections is if you do not respond to the treatment that you've been provided by your doctor, you want to go back because you want to make sure you don't have an unusual resistant organism called MRSA, MRSA, or methicillin-resistant Staph aureus. This is a much more serious infection that's resistant to most of the typical antibiotics that normally would be used for skin infections. This used to only be seen in the hospital, but in the last 10 years we see it in the community all the time. Almost every week we have a couple of patients with MRSA. So as with any medical condition you ever have, whether it be infection or anything else, if the medication you've been given doesn't work, please go back to your doctor and get another opinion. Have them reevaluate it, because sometimes things aren't quite what we think they are. And you always want to get a second opinion, especially if you have the chance of having MRSA infection. Fungal infections of the skin are fairly common, and the most common occur on the feet in something what is called tinea pedis, or athlete's foot, in the groin, called jock itch, or by dermatologists, tinea cruris, or on the body, which is referred to as ringworm, which we call tinea corporis. Now, ringworm is really a misnomer. It really has nothing to do with worms. They happen to occur in rings, and that's how the name ringworm came from. These infections are very easy to treat with topical creams that are very effective, and occasionally with oral antifungal pills. Another common type of fungal infection on the skin is one called tinea versicolor. This presents as whitish, brownish, pinkish, scaly patches, most commonly on the trunk. It's often seen in the summertime when someone tans funny and they say, gee, I'm getting spots when I'm not tanning normally. This can be cleared up very, very easily with an oral antifungal medication. However, this is a very common condition to recur, so we can treat it, you do fine, and a year or two later it can recur, we treat it again. None of these fungal infections are really very risky, and they're all very treatable. The two most common viral infections we see are warts and Molluscum contagiosum. Warts can occur anywhere in the body. They're more common in children. They usually appear as dry, cauliflower-like growths that stick out on the skin. Hands, elbows, very common. The bottoms of the feet are another common place, and they're called plantar warts because they're occurring on the bottom of the foot, which is the plantar surface of your body. There's nothing different about that wart, it's just the location. Warts are treated with liquid nitrogen. Warts can be treated with a variety of topical medications. Again, they're due to a virus, so nothing that we do actually kills the virus. We're killing the skin that's infected with the virus, so they can be very persistent and recurrent, and you may need several treatments to eradicate your warts. Molluscum contagiosum is another common viral infection, more common in children, and these look like firm little pimples, often with little dimple in the center. They're more common when there's a barrier problem, such as children with atopic dermatitis have a problem with the skin barrier. They're more likely to get this infection. These also are treated with liquid nitrogen and some topical medications. Both of these conditions are viral infections. We don't have anything that kills the virus. All the treatments we use to treat these viral infections are destroying the skin that's infected with the virus, so often you need multiple treatments and regular follow-up, and just observe to see if anything is recurring, and if it is, come on back and get it retreated.